they've been talking with the private sector and getting the private sector to donate money and funds. Children's clubs. I mean, a lot of these activities are in other districts as well, but I've never seen a district so enthusiastic and so streaming along like that.
Okay, Linda, based on these best examples, successful examples, what are the driving factor behind the success of WASH program?
Leadership from government has been stellar. I think they saw that the education sector and the health sector had a lot of collaboration and coordination between and agreements and all between the government and the lead donor agencies. And so they realized they could do that too, and they have started doing that in a really admirable way. So they're working with us, but they also have developed analytical skills, and they have whole sections that are devoted to analyzing the progress of the WASH movement. That's in sanitation, but also in water supply.
Can we say if there is successful or good governance and good leadership, there can be meaningful participation of peoples in the movement in every development, can we say?
It starts with government, and then it's matched at the community level. And those of us who are supporting, we're just doing that, we're supporting. It's a matter of community talking to district government, their local government, district and central. That's the continuum, and that's what we want to support. We know that as donors, our little bit that we can do only goes so far. So we look to those areas where government can take over, or the community can take over, or a tipping point gets started where everybody wants to be on the bandwagon.
What are the optimistic area or optimistic factors to achieve that target by 2017?
I have to return to Chaupati and say that I think that as people start recognizing your program is Rupantaran or transformation, if enough of the gatekeepers of tradition would agree that menstruation and childbirth are actually the sacred parts of the life cycle, then they'll continue increasing in helping protect those times instead of restricting those times. And I see that happening. I think that's going to be a big change in Nepal.
What is your development expectation from Nepal in coming days?
Well, my expectation is that the sanitation movement's going to increase in momentum, not decrease. That government and all the development agencies are going to continue having a good time and a really successful creative time together. And that we're going to find those ways to improve the water supply, the functionality of water supply, and to reach people that have not been reached. There's still 11% by the last counting that haven't been reached. And rainwater harvesting, I think, is one really important thing to be looking at. It's a complementary but important component of water supply. And also, people are looking at incentivizing communities to do better and take better care of their water supply. I think that's really important. It can't always be from outside, and it isn't. Communities do and must take care of their own systems, but we're starting to think as a sector, what are the specific nodal points that communities have to be involved in? Those committees and maintenance workers, water tariffs, becoming ODF and being rewarded for being ODF by improving the water supply, all those kinds of incentives.
Okay, thank you very much for your time and for your sharing this experience.
Well, thank you for the opportunity. It's been a pleasure to talk about WASH and what the U.S. government, along with the Nepali government and so many other partners, are doing.
धन्यवाद.
धन्यवाद तपाईलाई.
हस्त दर्शकवृन्द, यही कुराकानीका साथ आजको रूपान्तरण कार्यक्रम यही सकिन्छ। जाँदा जाँदै फेरि यही वाससँग सम्बन्धित सानो जानकारी। विश्वमा न्यून आय भएका देशहरूमा मानिसहरूको अकालमा मृत्यु हुने कारणमध्येको दोस्रो कारण झाडा पखाला जन्य रोगहरू मानिन्छ, जुन पानी कमजोर अर्थात् दूषित पानी र कमजोर सरसफाइका कारणले गर्दा हुने गर्दछ। त्यसैगरी नेपालमा 5 वर्ष मुनिका करिब 10,500 बालबालिकाको अकालमा मृत्यु हुन्छ यही कमजोर सरसफाइ र दूषित पानीका कारणले गर्दाखेरि। नेपालले हरेक वर्ष 10 अर्ब रुपैयाँ बराबरको क्षति बेहोरिरहेको छ यही कमजोर सरसफाइ र दूषित पानीका कारणले गर्दाखेरि र 80% भन्दा बढी रोगहरू पानी र खराब सरसफाइको कारणले लाग्दा रहेछन्। त्यसैले गर्दा वास अर्थात् जुन हामी खानेपानी सरसफाइ र आरोग्य भनेर भनिरहेका छौँ यसको समष्टिगत विकाससँग अत्यन्त नजिकको सम्बन्ध हुँदो रहेछ। यही बारेमा आज हामीले कुरा गऱ्यौँ र यही कुराकानी र यही जानकारीका साथ आजको कार्यक्रम यहीँ सकिन्छ। अर्को हप्ता फेरि तपाईँ हाम्रो भेटघाट हुन्छ। फेरि जाँदा जाँदै लिन्डा नमस्कार।
नमस्कार।
दर्शकलाई पनि नमस्कार।